Welcome students to this anatomy lecture on the larynx. So this is Dr. Yusuf. Specific objectives for you in the College of Medicine, Al Juf University uh, for the respiratory block. Uh, for this topic will be mention the location of the larynx, name is its cartilages, ligaments, membranes, joints and outline its formation. List extrinsic and intrinsic muscles of the larynx and state their actions and nerve supply. Outline boundaries of the inlet of larynx. Describe the interior of the larynx. Outline blood supply, nerve supply and lymphatic drainage of the larynx. Describe the trachea as regards its beginning, termination, course and relations. Mention the blood supply, nerve supply and lymphatic drainage of the trachea. Mention the constructions of the trachea and their levels. List the difference between the right and the left main bronchi. Explain the terms primary, secondary and tertiary bronchi. So these are some of the objectives which are you for the larynx, which you are supposed to cover not only in the lecture, some might be covered even in the PBLs, labs, seminars, in or some other activity, even in STLs. So you have to cover all these objectives in all those sessions. Anyhow, we'll try to cover as much as possible. The first one is we'll begin with the larynx. So the larynx, as you know, it's an organ of phonation, that is, it produces voice. That's why it is also called as the voice box. So it is also the passage for the respiration. So that's why it is also called as the windpipe, air passage or windpipe. So it has two functions. One, it produces voice, important one. The second one is it is also a respiratory passage. The third thing is it also acts as a protective sphincter for the foreign particles. That's why it is called as the watchdog for the foreign bodies. Okay, so it acts as a sphincter. So whenever foreign body tries to enter the air passage, at that time it closes and prevents from entering. So what is the extent of this larynx? So the larynx extends from, if you see this picture, from the upper border of the epiglottis here. So this is the upper border of the epiglottis to the lower border of the, there is a cartilage here called as the cricoid cartilage. So in this picture you can see here the cricoid cartilage corresponds to this part here. So this is the cricoid cartilage and here the epiglottis. This whole thing extends from here to here. This part is called as the larynx. So the larynx extends from the upper border of the epiglottis to the, so this is the upper border of epiglottis to the lower border of the cricoid cartilage. So if you see it in relation with that of the vertebrae, so it will begin from the C3 vertebra, third cervical vertebra. If you can see here, it is numbered as 2. So this is the third cervical vertebra. It extends from the third cervical vertebra up to the 6th. It has been mentioned here as 6th. So it extends up to the 6th cervical vertebra. So in case of adults, but in case of children it is much more higher, and it is from C1 to C4 vertebrae in case of children. But in case of adults it is well developed and it has descended downwards. Communication, it communicates above with the laryngopharynx and it continues below as the trachea. So above it will be communicating with the laryngopharynx and continues below as the trachea. The growth of the larynx in adults, especially in case of female, is much slower compared to the males, and hence the voice is similar to that of a child. So it is high pitch, just like that of the children. Even the female voice is high pitch because the female larynx is has developed to a lesser extent compared to the male, and it has not descended much. So it will be similar, the voice as well as the pitch will be similar to that of a child. In case of males, the voice is much more deep due to the well development of the larynx as well as the angulation of the thyroid cartilage. This is the thyroid cartilage. So here you can see the epiglottis at the top, and here this is the cricoid cartilage. This is the whole extent of the larynx seen from front, and this is from the side. So if you see here, the angle between the two thyroid cartilages, these are called as the laminae of the thyroid cartilage on either side. So they meet in the center, in the midline, and they make an angulation which will be much more deeper and angulated. That's why you can see the angulation in the males as the Adam's apple. So if you can see here in the larynx, there is a structure which will be moving when you swallow. It will be much more prominent in case of males as well as thin males. It will be moving up and down. So this is because of the much more angulation in case of males. So that's why the voice is also deep. Compare the measurements in case of the males and females. In case of males, it is much more larger, almost 44 millimeters into length, then 43 millimeters in breadth and 36 millimeters in depth. So this is in case of male, but in case of female, it is little smaller compared to the male. It is almost 36 millimeters in length, 41 millimeters in breadth and 26 millimeters in thickness. Now coming to the skeleton of the larynx, we will discuss about how the larynx has a skeleton and how it is, what is it made up of. Okay, skeleton of the larynx, just like we have the skeleton of our body, similarly even the larynx has a skeleton, but it is not made up of bone, it is made up of cartilages. So there are 9 cartilages which make the skeleton of the larynx. So there are divided into 3 paired and 3 unpaired. So which are the unpaired cartilage? We will first discuss the unpaired cartilages, then the paired cartilage. The first one is the thyroid cartilage. So if you can see here, this is the side view and this is the posterior view. We will be seeing most of the views of the larynx from the posterior side because it is seen much more clearly from behind than from the front. So anyhow, so here you can see this is the thyroid cartilage. This is the view of the thyroid cartilage from the behind. So it is only covering the anterior part. Posteriorly it is totally free. Okay, so these are the lamina of the thyroid cartilages. So here you can see this is the lamina of the cartilage on one side and the other will be other side. So this is the thyroid cartilage. The second cartilage is the cricoid cartilage. This is the cricoid cartilage seen from the side. It is much more smaller in the side, in the front, compared to the posteriorly. It is much more broader, bigger. So this is how you can identify the cricoid cartilage. Cricoid cartilage is smaller on the sides in the front view and it looks much more bigger from behind. So this is the second cartilage, which is the cricoid cartilage. The third cartilage is the epiglottis itself. So here is the epiglottis, so which is the third cricoid cartilage. So there are 3 cartilages which are unpaired, which are at the midline. Okay, the first one is the epiglottis, the second is the thyroid cartilage, and the third is the cricoid cartilage. Here again you can see here this is the epiglottis seen from side. This is the thyroid cartilage and this is the cricoid cartilage. So these are the unpaired cartilage. Which are the paired cartilage? Again, there are 3 paired cartilages. One is called as the arytenoid cartilage. There is a pyramid-like structure cartilage which is called as the arytenoid cartilage. So they are paired, they are on either side. So they are 2. So that's why they are called as paired. So they are 2 arytenoid cartilage. Similarly, there are also smaller cartilages. The second type is called as the corniculate. So again they are paired. See, these are the corniculate. And very small one that is called as the cuneiform. These are very small cartilages seen from behind. So these are the paired cartilage. One is the arytenoid cartilage, then the corniculate and the cuneiform. So these 3 become 6 and these 3 totally 9 cartilages. 3 paired and 3 unpaired. Okay, so there are totally 9 cartilage. Paired cartilage becomes 6. Now you should know that the formation of these cartilages, all the laryngeal cartilages are made up of hyaline cartilage. All these cartilages of the larynx are made up of hyaline cartilage, except the epiglottis, the corniculate, cuneiform, and vocal and apex of the arytenoid cartilage. So except these, all other cartilages are made up of hyaline cartilage. So these cartilages which are not made up of hyaline cartilage will be made up of fibroelastic cartilages. These are made up of fibroelastic cartilage because they don't undergo ossification. So the epiglottis doesn't ossify. If it ossifies, it cannot move. So that's why it has to be non-ossified cartilage. So it will be fibroelastic cartilage. Hyaline cartilages can later become bonish. Okay. Coming to the muscles of the larynx. The muscles of larynx are of two types. One is intrinsic, the other one is the extrinsic type. So the intrinsic and the intrinsic first we'll name them initially, then we'll discuss in detail about these muscles. The first one is the cricothyroid, the second is the posterior cricoarytenoid muscle, the third one is the lateral cricoarytenoid, the fourth is the transarytenoid, fifth is the oblique arytenoid, sixth is the epiglotticus, the seventh is the thyroarytenoid, the eighth is the thyroepiglotticus, and the last one is the ocalis. So these are some of the intrinsic muscles of the larynx. Which are the extrinsic muscles? Which are already studied in the musculoskeletal system. One is the thyrohyoid, sternohyoid, omohyoid, sternohyoid, digastric, stylohyoid, mylohyoid, genohyoid, hyoglossus. All these are the muscles of the larynx which are extrinsic and they are present in the neck. You have studied these muscles as infrahyoid and suprahyoid muscles. The infrahyoid muscles, this is the sternohyoid, then we have the sternothyroid here, and this is the thyrohyoid, this is the omohyoid, then the suprahyoid muscle like the digastric, mylohyoid, this is the stylohyoid, and the hyoglossus will be deep inside. So all these muscles are the extrinsic muscles of the larynx. So here these you can see here, these are the extrinsic, the suprahyoid muscles which are extrinsic muscles. Okay, now we should concentrate more on the intrinsic muscles of the larynx. Okay, so the first one we'll discuss is the cricothyroid muscle. So here you can see here, this is the cricothyroid muscle. This is you should remember that all the muscles of the neck, the name itself indicate a lot of things. One of the thing is they indicate the origin and insertion. Whenever it says cricothyroid muscle, it means it is taking origin from the cricoid cartilage and getting inserted to the thyroid cartilage. So the name itself indicates the origin and insertion. So this muscle, the cricothyroid, will take origin from the lower border and lateral surface of the cricoid cartilage from outside and get inserted to the inferior conus and lower border of the thyroid cartilage. So here, so this is the origin and this is the insertion. The typical feature, the special feature of this muscle is this is the only intrinsic muscle which is in the external aspect, which is outside the larynx. So this is the typical feature. Intrinsic muscle intrinsic means it should be inside, but this is the only intrinsic muscle which is present outside the larynx on the external aspect, and it is also supplied by the external laryngeal nerve. What about the other muscles? We'll discuss that later. So this is the only muscle which is present, even though it is called as extrinsic, it is supplied by the it is outside the larynx and supplied by the external laryngeal nerve. What is the action? It tenses the ocal ligaments and closes the glottis. This is almost same for all the muscles except one. We'll discuss that later. Okay, so it tenses the ocal ligaments and closes the glottis. The second muscle, very important muscle, is the posterior cricoarytenoid. So the name itself indicates, as I said, the origin insertion posterior because it is present in the posterior side and can be seen from behind. it is cricoarytenoid. So it take origin from the cricoid cartilage, get inserted to the arytenoid cartilage. So the origin is from the posterior surface of the lamina of the cricoid cartilage. This is the lamina of the cricoid cartilage. So it takes origin from the posterior surface of the lamina cartilage and get inserted to the muscular process of the arytenoid cartilage. This is the muscular process of the arytenoid cartilage. So it get inserted to the muscular process of the arytenoid cartilage. What is the action? The very important action is that it opens the glottis. So if you can see here, this is the opening of the glottis. So this is how the glottis will look like. So when it is closed, will be like this, and when it opens, it will be like this. Okay. So when the muscle contracts, so both the muscles are contracting, and it will pull the muscle and it opens the glottis. So the most important thing you should remember, this is the sole abductor of the vocal folds. This is the only muscle which abducts or opens the vocal folds. Very important function. It is the sole abductor of the vocal fold. It is the only muscle which opens the vocal folds. That's why this is called as the safety muscles of the larynx. This is the safety muscle of the larynx because it opens and it prevents the death of the person. So this is said to be the most important muscle in the body, because if this muscle doesn't act, so you cannot open the larynx and you cannot open the vocal folds. So what happens? You cannot respire, no breathing, and it might lead to death. So that's why this is said to be, if this muscle is intact, then the other things. So that's why it is said to be the one of the most, perhaps the most important muscle in the body. Coming to the next muscle, so you should remember this is the only muscle which abducts, which is the abductor of the vocal folds. All other muscles are the adductors of the vocal folds. That is, it closes the vocal folds. All other muscles close the vocal folds. Okay. So the third muscle is the lateral cricoarytenoid. So the third muscle is the lateral cricoarytenoid. So it will be present on the same. The name indicates similar names. Lateral, the cricoarytenoid is same. Here it is posterior, so it will be present on the posterior side. This is also taking origin from the cricoid cartilage, getting inserted to arytenoid, but it is on the lateral side. If you can see here, so it is taking origin from the cricoid cartilage and getting inserted to the arytenoid cartilage, but it is on this side. So it has been shown here, even though it is not seen from outside, it should be seen from inside, but this is just to give you the impression how exactly it is attached. So it is taking origin from the cricoid cartilage, getting inserted to the arytenoid cartilage. Here you can see it is inside. When it contracts, it will be closing the glottis. So it's take origin from the lateral part of the upper border of the arch of the cricoid cartilage and get inserted to the muscular process. The same process here, get inserted to the muscular process of the cricoid cartilage, the muscular process of the arytenoid cartilage, and when it acts, when it contracts, it helps in the closure of the glottis. This is how the glottis will be closed. This is the movement with which it closes. So this is the posterior cricoarytenoid which opens, the lateral cricoarytenoid which closes. Now coming to the transverse arytenoid. So here you can see that this is the transverse arytenoid, as the name indicates, transverse because it is the muscle, only muscle which is transversely placed, and it takes origin from arytenoid. There is only one name, so it means it takes origin from one arytenoid, get inserted to the other arytenoid. So that's what is called as only arytenoid. There are no two names here. So it is the arytenoid because it takes origin from one arytenoid, get inserted to the other side. So the origin is from the posterior surface of the one arytenoid cartilage to the inserted to the posterior surface of the opposite arytenoid cartilage. This is the origin insertion. The special typical feature is this is the only unpaired intrinsic muscle. All muscles are paired, they are present in twos, but this is the only muscle which is only unpaired muscle. So it is only a single muscle. All other muscles are double on either side. So this, like all other muscle, this also closes the glottis. So here you can see the action when they contract, it closes the glottis. Then the next muscle is the oblique arytenoid. So as the name indicates, again it is only arytenoid, so it begins from one arytenoid, goes to the other arytenoid. But the difference is this is horizontally placed, this is obliquely placed. Okay, this is the difference. Okay, and it is present in pair. So the origin is from the muscular process of one arytenoid and get inserted to the apex of the opposite arytenoid. So this is the origin and this is the insertion on either side. So it is in pairs. This, like all other muscles, this also closes the inlet of the larynx. There is a muscle which continues from this oblique arytenoid, from the apex of the arytenoid cartilage, from the upper part of the oblique arytenoid and continues up to the epiglottis. So that's why it is called as epiglotticus, because it is beginning from the arytenoid cartilage and going to the epiglottis. So that's why it is called as the epiglotticus. The origin is from the continuation of the fibers of the oblique arytenoid and get inserted to the edge of the epiglottic cartilage. Action, like all other muscles, this also closes the inlet of the larynx, especially this epiglottis will close, it will fold on the inlet itself and pulls the epiglottis downwards. So when this muscle contracts, it will pull the epiglottis downwards and it closes the inlet of the larynx. Then there is one more muscle here, this is called as the thyroarytenoid muscle. So this muscle will take origin from the thyroid cartilage. So you can see from inside, this is how it looks like. Even though here it is shown from outside, it is not outside, it is inside. This is just the impression of how it is taking origin from inside. This is how it is placed. So it is taking origin from the thyroid cartilage going to the arytenoid. That's why it is called as the thyroarytenoid. So it takes origin from the posterior aspect of the angle of the thyroid. This is the angle of the thyroid cartilage. So it takes origin from the angle of thyroid cartilage as well as adjacent part of the cricothyroid ligament and get inserted to the anterolateral surface of the arytenoid. So here you can see the anterolateral surface of the arytenoid cartilage. So when it contracts, it helps in again closure of the glottis and relax the vocal cords. Now there is a small muscle which continues from this thyroarytenoid. This is called as the thyroepiglotticus. So this is the thyroarytenoid. Some of the fibers, instead of going into the arytenoid, it goes above to the epiglottis. This is called as the thyroepiglotticus. Some of the upper fibers of the thyroarytenoid will continues and goes to the edge of the epiglottis. So this is the epiglottis where it goes and gets inserted. So this muscle opens the larynx. Even though it opens the larynx, this is a very small muscle, few fibers, so it have very less importance compared to the posterior cricoarytenoid cartilage muscle. Okay. Coming to the last muscle, that is called as the ocalis. This is the muscle which some of the fibers of the thyroarytenoid. So this is the thyroarytenoid which will get inserted to the ocal ligament. So they form the ocal fold. This is called as the ocalis. So the action of this muscle is it relaxes the ocal cords. So here will be the ocal folds and the ocal cords. So it will relax the ocal cord when it contracts. Now coming to the cavity of the larynx. So whenever you examine the larynx, you should know some of the areas, important areas where there might be infection, foreign body or something like that, or carcinoma, something like that. So you should know the parts of the cavity of the larynx. As I said, the extent of the larynx extends from the upper border of the epiglottis, that is from the laryngeal inlet to the lower part of the cricoid cartilage. So here you can see the cricoid cartilage, it extends up to the cricoid cartilage. This whole thing is the larynx seen from behind and the cavity. If you see, the anterior border is much more longer compared to the posterior border. This can be observed especially when you see from this side. You can see here. So this is the larynx. The posterior border is very small compared to the anterior border. Anterior border is very big and the posterior is deficient. Okay, so the anterior border is much more longer compared to the posterior border due to the obliquity of the inlet itself. Okay, the interior has 3 pairs of mucosal folds which are important, which should be known, and these are from above downwards. One is the epiglottic fold. There is a mucosal fold here which is called as the epiglottic fold. Then there is second fold which is called as the vestibular fold here, and the third fold is called as the ocal fold. These 3 folds are very important. for all the functions of the larynx. Coming to the spaces, the space between the aryepiglottic fold, this is the space between the aryepiglottic fold form the laryngeal inlet. So this is the folds of the aryepiglottic folds on either side. Here it has been shown with the mucus, here it is shown just the cartilage and the deep structure inside. So the space between these folds will be called as the laryngeal inlet. So this will be laryngeal inlet. The space between the vestibular folds, so the space between the vestibular folds will be called as the rima vestibuli. In this picture is much more clearer. If you can see here, these are the vestibular folds. This is when they are open and when they are closed. So the space between these two vestibular folds is called as the rima vestibuli. Then there is also a small space, narrow cleft between the vocal folds and the vocal process. This is called as rima glottidis. These are the vocal folds, and between the vocal fold there is a small space here. This is called as the rima glottidis. The space between the two vocal vestibular folds, this will be called as the rima vestibuli. The space between the two vocal folds will be called as the rima glottidis. Now we have to know some of the areas in this larynx. One is the interior of the larynx, laryngeal cavity is divided into three parts. The part which is above the vestibular folds from the epiglottis, to the vestibular fold, this space is called as the vestibule. The space between the vestibular folds and the vocal fold, there is a small space. This is called as the ventricle, or it is also called as the sinus of the larynx. So this is the sinus of the larynx, or the ventricle. There is important space where there might be foreign body adherent, or sometimes even the fistula can form. Many things are there. Okay, this is also the site for the infections. The third is the part which is below the vocal fold. This is called as the infraglottic part. This is the infraglottic part just above the trachea. This part here below the vocal fold, that will be called as the infraglottic part. These are the three parts. One is the vestibule, which is from the epiglottis up to the vestibular fold. The space between the vestibular and vocal folds is called as the ventricle, or it is also called as the sinus of the larynx. And the part which is below the vocal folds, it is called as the infraglottic part. Rima vestibuli, that is the space between the two vestibular folds. This is this fold, this is the space. This rima vestibuli acts as an exit valve by preventing air exit during expiration. So this acts as exit valve by preventing the air exit during the expiration. And this is important in holding. Whenever these two vestibular folds contract, it helps in this. When these two vestibular folds contract, it helps in holding the breath, and this holding of breath act is very important in case of micturition, defecation, coughing, sneezing during labor. All these acts which needs pressure and which has to be transferred to the abdomen, this can be done by holding the breath, and this can be done by bringing the two vestibular folds very close and closing this rima vestibuli. Rima glottidis is the narrowest anteroposterior cleft of the laryngeal cavity. You have seen the laryngeal cavity and the space between the two vocal folds, that will be called as the rima glottidis, and this is the narrow space, and this is important because this is narrow space, and sometimes if the foreign body has escaped all the above parts and it has come, this is the point where you can actually trace this foreign body, because this is the narrowest part. Now coming to the inlet of the larynx. So the instrument we use for this to see the inlet of the larynx will be called as the laryngoscope. So here you can see this is the traditional laryngoscope, and if you can see here, they are lifting the larynx so that they can bring, because the larynx is in the front, so this laryngoscope has to be brought in line with that of the larynx itself. So it will pull the epiglottis and it can be brought in line with the larynx, so that you can see the larynx clearly. Okay, so this is the laryngoscope, but nowadays there are very flexible instruments with the camera and other things, and they are very flexible laryngoscope. This is the traditional old type of laryngoscope. So when you see through the laryngoscope, what do you see? This is how it looks like. So you should be able to identify what exactly is this, what are these structures which are seen through the laryngoscope. This inlet of larynx is also called as the additus laryngis. Additus laryngis. Okay, what are the boundaries for this? So in the front we have the upper margin of the epiglottis. If you can see this picture, it can be made very much clearly. Then try to compare it with this picture, how it looks like here. So the first structure is in the front will be the upper margin of the epiglottis. So this is the upper margin of the epiglottis, and here you can see here this is the epiglottis upper margin. Posteriorly, we have the interarytenoid fold. There are two interarytenoid cartilages, and there is a fold on that. This is called as the interarytenoidal fold. So the two arytenoid cartilages with the fold of the mucous membrane, this will form the posterior boundary. And on the lateral side, there is a mucosal fold which extends from the epiglottis to the arytenoid. This is called as the aryepiglotticus. So this is the aryepiglottic fold on either side. So this is the aryepiglottic fold on the other side. So here you can see here, this is the aryepiglottic fold. So these are the structures which you are supposed to identify. In the front it will be the epiglottis itself. Posterior we have the arytenoid covered by the interarytenoid fold, and on either side we have the aryepiglottic fold, which is a mucous membrane extending from the arytenoid cartilage to the epiglottis. And this is lined by non-keratinized stratified squamous epithelium. This epithelium is important again. So it is lined by non-keratinized stratified squamous epithelium. Coming to the next part, that is the membranes of the larynx. We have discussed the muscles of the larynx. We have discussed the cartilage of the larynx. Now we are discussing the membranes of the larynx. So to be very specific, there are three membranes. Two can be seen from outside. One is called as the thyroid membrane. So there is a membrane between the thyroid cartilage and the hyoid bone. This membrane is called as the thyroid membrane. This is the membrane which is between the thyroid cartilage and the hyoid bone. This is called as the thyroid. The second membrane is between the cricoid cartilage and the thyroid cartilage. This is called as the cricothyroid membrane. This membrane becomes the fibers of this membrane become much closer, and this forms a ligament. This is called a cricothyroid ligament, and there is also a small muscle called as the cricothyroid muscle. So these are the two membranes which can be seen from outside: hyoid membrane and the cricothyroid membrane. The third membrane can be seen only from inside. This is called as the quadrangular membrane. Now coming to the nerve supply of the larynx. The muscles of the larynx are supplied by all the muscles of the larynx supplied by the recurrent laryngeal nerve. Recurrent laryngeal. If in this picture, if you can see here, this is the larynx here, and this is supplied by all these muscles are supplied by the recurrent laryngeal nerve. So this is the motor nerve, except one muscle, which is the cricothyroid. So you remember that we had seen that the cricothyroid muscle is outside. This is the only muscle which is present outside. All other muscles are inside. All intrinsic muscles are inside. So all intrinsic muscles which are inside are supplied by the recurrent laryngeal nerve, except the cricothyroid, which is outside, and so it is supplied by the external laryngeal nerve. Okay, this is what you're supposed to remember. All are supplied by the recurrent laryngeal nerve, and only the cricothyroid is supplied by the external laryngeal nerve. This is the motor supply. What about the sensory supply? The recurrent laryngeal nerve not only is a motor nerve, but it is also sensory. So it is a mixed nerve which supply the part below the vocal fold. So the recurrent laryngeal nerve supplies the area of the larynx below the vocal folds. Okay, so below the vocal fold, it is supplied by the recurrent laryngeal nerve. What about the area above the vocal fold? It is supplied by the internal laryngeal nerve. So you should remember, the recurrent laryngeal nerve supplies all the muscles of the larynx except the cricothyroid, as well as it is sensory also below the vocal folds. Above the vocal fold, it is supplied by the internal laryngeal nerve. Okay, so this is what you are supposed to remember. Now coming to the will not go into detail about the superior laryngeal nerve. We'll go to the blood supply. Again, just like the nerve supply, even the blood supply, even the venous drainage, even the lymphatic drainage is divided into below the vocal folds as well as the above the vocal folds. Above the vocal fold, it is supplied by an artery which is called as the superior thyroid artery. So if you can see here in this picture, superior thyroid artery is a branch from the external carotid artery which supplies the thyroid gland. When it supplies the thyroid gland, it also gives a small branch which supplies the larynx. So the part of the vocal above the vocal fold, the part of the larynx is supplied by the branch from the superior thyroid artery called as the superior laryngeal artery. So this is the superior laryngeal artery which supplies the larynx above the vocal fold. What about the space below the vocal fold? It is supplied by the inferior thyroid. If you see here, the inferior thyroid artery which will be supplying. So if you can see here, this is the inferior thyroid artery which supply the thyroid gland. Along with that, it gives a small branch, this is called as the inferior laryngeal artery, which supply the area below the vocal fold. So above the vocal fold, it is by the superior laryngeal artery, branch of the superior thyroid artery. Below the vocal folds, it is the inferior laryngeal artery, branch of inferior thyroid artery. Venous drainage is also very similar to that of the blood supply. So the names with similar names will be draining the larynx. So above the vocal fold, it will be the superior laryngeal vein, and below the vocal folds, it will be the inferior laryngeal veins. Coming to the lymphatic drainage, above the, again this is also above and below the vocal fold. Above the vocal fold, it will be into the draining into the neck, into the prelaryngeal as well as the jugulo-digastric lymph nodes. So these are the lymph nodes which are present in the neck, and all these area above the vocal folds is drained into the prelaryngeal as well as the jugulo-digastric lymph nodes. Below the vocal fold, it is draining into the pretracheal and paratracheal group of lymph nodes. Pretracheal and paratracheal will be here. If you can see here in this picture, some have been shown. Pretracheal and the paratracheal group of lymph nodes will be there on either side of the trachea, and this will be draining into the pretracheal and paratracheal group of lymph nodes. So in between these two, there is an area where the lymphatic drainage doesn't cross, so it forms a watershed line of the larynx. Hence, remoglottitis acts as the watershed line of the larynx. So the remoglottitis or the vocal folds forms a line which is not crossed by the lymphatic drainage above and below. So it forms a watershed line where they don't cross. So above the vocal folds, they will be draining into the neck, prelaryngeal and jugulo-digastric lymph nodes, and below the vocal fold, it will be draining into the upper part of the chest, into the pretracheal and the paratracheal group of lymph nodes. Now coming to the trachea, this is also called as the windpipe. So it is a cartilaginous as well as cartilaginous membranous tube forming the beginning of the lower respiratory passage. So it is a cartilagino-membranous tube forming the beginning of the lower respiratory passage. So it begins from the lower part of the larynx. You have seen the end of the larynx at the lower border of the cricoid cartilage. From there begins the trachea. So it is covered by the cartilaginous rings as well as the membranous part in between, and it forms a tube which is always patent because of the presence of these cartilaginous rings. It lies partly in the neck and partly in the thorax. If you see, the upper part of the trachea will be can be palpated in the lower part of the neck, where you can feel the trachea, and the lower part enters the thoracic part. So partly it is present in the neck and partly in the thoracic part. The measurement, if you see the measurement, the length of this trachea is almost 10 to 12 centimeters in length and almost 4 to 6 inches in inches, and the breadth is almost 2 centimeters in diameter, and it is always open, that is, it is patent due to the presence of C-shaped cartilaginous. And these are the rings, which are the tracheal rings, also called as the cartilaginous rings. And this cartilaginous rings will keep the trachea patent. It will be keeping the trachea patent. And there are almost 16 to 20 cartilaginous rings which are present there. So there are 16 to 20 cartilaginous rings which are made up of hyaline cartilage. So again, the hyaline cartilage is important because they don't ossify. They can ossify. Okay. So these are the cartilaginous rings which are covering the trachea only in the front, not from behind, because the C shape, the lower back part is not having the cartilage. So what is it covered by? It is covered by a muscle called as the trachealis muscle. So behind we have the trachealis muscle, in the front we have the cartilaginous rings. Okay, so why there should be a trachealis muscle? Why not the cartilaginous rings are complete? Because it permits the expansion of the footballers within the esophagus, because the esophagus is behind. If it is complete cartilaginous ring, then these cartilaginous rings will press the esophagus and there might be difficulty in deglutition. So to prevent that, it is made up of muscle that is called as the trachealis muscle, which help in smoothly swallowing of the food particles. Okay. As I said, the beginning of this trachea is from the lower border of the cricoid cartilage, because the cricoid cartilage will be the end of the larynx. So it is at the level of the 6th cervical vertebra, and it runs downwards, backwards, and toward the right side. The trachea is slightly deviated. It is not exactly at the center, but it is slightly toward the right side and in front of the esophagus. You can see here the esophagus behind. This is the trachea and this is the trachealis muscle, and see how it is well placed and not pressing the esophagus. And this trachea will go into the thorax and it divides into two primary bronchi at the level of the 4th thoracic vertebra, corresponding to the sternal angle. Sternal angle is this part where the manibrum sterni and the body of the sternum will meet at an angle. So this is the level of T4 vertebra. So this is the point where the trachea will go into the chest and divides into two primary bronchi. Relations in the neck. So in the front, in the neck, if you see here, it is very close to the skin, superficial fascia, and the investing deep cervical fascia. So that is the only structures which will be covering the this trachea. So you can feel, if you press the neck at the upper border of the sternum, the manibrum sterni, here you can feel the trachea itself. So because it is just covered by skin, superficial fascia, and the investing deep cervical fascia. Behind we have the esophagus. You can see here, this is the esophagus and the recurrent laryngeal nerve, which is supplying, as you have seen, the larynx. Laterally, we have the lateral lobe of the thyroid glands on either side in the neck, as well as the common carotid artery. You can see here, these are the common carotid artery on either side, as well as the inferior thyroid arteries will be there. That will be the branches here. So those will be the lateral relations. In the thorax, it will be in the superior mediastinum. Anteriorly, there will be the manibrum sterni in the thorax. This is the thoracic part, where anteriorly there will be the manibrum sterni. Then there will be a muscle called as the sternothyroid muscle, as well as a small gland here, which will be called as the thymus. Posteriorly, we have the esophagus again and the vertebral column. Here you can see the vertebral column, and in between there will be esophagus. On the right side, we have the right lung as well as the pleura, as well as the right vagus, as well as the azygous vein. And on the left side, we have the arch of aorta, left common carotid, as well as subclavian vein, as well as the artery. Coming to the blood supply of this trachea, it is supplied by the inferior thyroid artery, which is the artery which supplies the lower part of the even the larynx. This is the same artery which is supplying even the trachea. Venous drainage is into the left brachiocephalic vein, and the lymphatic drainage again is similar to that of the lower part of the larynx, that is the pretracheal as well as the paratracheal group of lymph nodes. Coming to the nerve supply, this is also similar, especially this autonomic nervous system, so it has the parasympathetic and sympathetic part. The parasympathetic is supplied by the vagus, again through the recurrent laryngeal nerve. It is sensory as well as secretomotor to the mucous membrane and motor to the trachealis muscle. So it acts as a motor muscle to the trachealis muscle as well as sensory and secretomotor to the mucous membrane. The sympathetic will be by the middle cervical ganglion. There are three cervical ganglions, superior, middle and inferior cervical ganglion in the neck. So this trachea is supplied by the middle cervical ganglion through inferior thyroid artery. There is a plexus of nerves around the inferior thyroid artery which will be supplying, because these small nerves might be very weak and they might get damaged, so they are around the inferior thyroid artery, and through that they will go and they will supply the trachea, and these are especially vasomotor. Now coming to the bronchi. Bronchi, as we have seen, the trachea divides into two primary bronchi. We have seen here, this is the trachea and it divides into two primary bronchi. So this is at the level of T4 vertebra. So this is the right bronchi and this is the left primary bronchi. So these bronchi are extrapulmonary as well as intrapulmonary. Extrapulmonary, that part which is outside the lung and the pleura, and the intrapulmonary part is that part which is inside the lung and the pleura. So each principal bronchus divides within the lung into secondary or lobar bronchi. When the primary bronchi go inside, they will divide into secondary or lobar bronchi. Okay, so because the secondary bronchi are also called as lobar bronchi, they will be actually aerating individual lobes. So on the right side, we, as you know, there are three lobes, so it will be dividing into three secondary lobar bronchi or secondary bronchi. On the left side, because there are only two lobes, it will divide into two secondary bronchi or the lobar bronchi. Then these secondary bronchi will further divide into segmental bronchi. On the right side of the lung as well as on the left side of the lung, there are 10 segments, small segments, small areas, and these are aerated by these segmental bronchi. And each segmental bronchus branches again 6 to 18 times to terminate into 50 to 70 respiratory bronchioles each. So these keep on dividing and dividing until they become the respiratory bronchiole, then the respiratory sacs, alveolar sacs, and then alveoli, everything. So that is the area from the respiratory bronchiole. It will actually the exchange of gases will be taking place. Now comparing the right bronchi with the left bronchi. If you compare the right bronchi, it is much more wider. As I said before, it will be, if you see here, this is the trachea, this is the trachea and its relations. So this is the trachea, and you can see this right bronchi is shorter as well as wider compared to the left bronchi. It is narrow as well as longer. It is very long, and compare this with the short and right bronchi. So the right bronchus is wider, shorter and more vertical than the left bronchus. If you can see here, this right bronchi is more vertical and it is almost in same plane as that of the trachea. As I said, the trachea is not exactly at the center but slightly deviated towards the right side, and this bronchi is shorter, wider as well as in line, almost vertical with the trachea. And the importance of this studying this is, usually if the foreign particles by chance if they enter the trachea, they can be traced into the right bronchus because it is wider, shorter, as well as it is more in line with the trachea. This right bronchus will divide into secondary bronchus, secondary bronchi, and as I said, because there are lobar bronchi, three lobes on their right side, so it will be dividing into three secondary bronchi or lobar bronchi. So the length of the extrapulmonary part here is about 2.5 centimeter. So 2.5 centimeter of that bronchi will be outside, and the remaining part will be inside. The left bronchus is much more longer, narrower, and more oblique. This is more vertical and this is more oblique. So the chances of foreign bodies is much lesser compared to the right bronchus. And it is divided into two secondary bronchi because secondary bronchi are also called as lobar bronchi, and there are only two lobes on the left side. And the extrapulmonary part is much more longer. As I said, it is much more longer and it is almost 5 centimeter. Here it is 2.5 centimeter, but this is 5 centimeters. So these are some of the differences between the right and the left bronchus. Okay. So other things about the bronchopulmonary segments and the tertiary bronchi and the bronchopulmonary segments and other details we will study in the next class, which is related to the lung and the bronchopulmonary segments. So if you have any doubts regarding this, you can ask me. Okay, thank you very much.